finish my shift. How about we answer Nicole's question? Definition of CPAP versus BIPAP and clinical indications for both, when to use one or the other or both. Y'all know I'm a talker, so I'm gonna try and keep this on point. CPAP is continuous positive airway pressure. Oh, wait. Let's back up a minute here. CPAP and BiPAP are both types of non-invasive ventilation. Sometimes abbreviated NIV. We love acronyms. It's just like it sounds, non-invasive ventilation, so it's the opposite of invasive ventilation, so it's the opposite of endotracheal intubation or mechanical ventilation. Both are alternative therapies, or they are bridging therapies to try and avoid or delay mechanical ventilation or invasive ventilation. Both can be used when someone is looking like they might need intubated and you're trying to do everything not to intubate them. They are both also treatments for chronic respiratory failure and not acute respiratory failure. Chronic respiratory failure, something like sleep apnea, obstructive sleep apnea, central sleep. They are also both treatments for varying degrees of heart failure. Yes, it is a non-pharmacological treatment for heart failure. Need I actually say out loud that none of what I'm saying is medical advice, and that these are simply educational pieces of information, nothing more. Let's keep that in mind. CPAP and BiPAP are used in chronic respiratory failure. So these can be home therapies or used in the hospital. Continuous positive airway pressure is CPAP, and that is, there is a delivery of air via a specific pressure at a constant rate. A continuous positive airway delivery, regardless of what the patient is doing, whether it's inspiration, expiration, apnea, it's a continuous blowing of air. And this is usually measured in the form of centimeters of water. So centimeters are water, millimeters, centimeters are water. So 5, 10, 15, or a variation of that. And you can further dive into that depending on the level of oxygen that you're being delivered, the level of oxygen being bled into that blow of air. CPAP is the first non-invasive treatment option for certain types of apnea, obstructive apnea, central sleep apnea, or heart failure. It's delivering a constant amount of pressure to try and eliminate apneic events, apnea or hypopapnea, sometimes called the AHI index. We're just going to stop there. So CPAP is constant pressure delivered regardless of what the patient is doing. First line therapy for chronic respiratory conditions. BiPAP is bilevel positive airway pressure. As you have guessed, it's two separate levels of the blowing of air, the positive pressure. And those two levels are inspiration and expiration. So you can have two different pressures for those two modes of breathing. CPAP is a singular number, 5, 10, 15, or a variation of that. BiPAP is two separate numbers, a number over a number, so almost like a fraction. Common BiPAP settings are 10 over 5, so 10 centimeters of water being delivered on inspiration, 5 centimeters of water being delivered on expiration. It could be 10 over 6, 12 over 6, 12 over 5, 15 over 8. I think you understand the point. Don't get bogged down on the settings, because I could give an entire talk on the settings and how we titrate them. The point is that BiPAP is the next step. So BiPAP is given to individuals and patients who have failed CPAP therapy, meaning that the therapy didn't solve the problem that they are having. It is also used, BiPAP is also used in chronic settings for at-home use, and also used when people are in the hospital. A third option that BiPAP has and you can utilize is they have what's called a backup rate, which means they can deliver this pressure at a given time every minute. And all that means is that someone who has, obstructive sleep apnea, they just stop breathing. We give them a breath every so often, like 5, 7, 8, 10 breaths a minute. Again, to clarify, CPAP and BiPAP are mostly can be used in chronic respiratory failure settings or heart failure or sleep apnea. CPAP is not usually used in the acute setting, meaning someone comes in with acute respiratory problems, distress. We don't usually do CPAP. It doesn't provide a lot of support. BiPAP is definitely used in COPDers, obstructive sleep apnea, obesity, hypoventilation syndrome, people who are really big bellied, big neck that have problems with apnea, and hypercapnia, meaning someone is retaining CO2. As you know, COPDers retain CO2. Too much CO2 causes altered mental status, can cause acidosis, whole nother lecture. So BiPAP is utilized as a preventative step to try and treat someone's acute or chronic respiratory failure without intubating them. And BiPAP is once again also utilized in heart failure patients. As an acute care nurse practitioner, I never have used a CPAP setting, a non-invasive CPAP setting. For all my ICU peeps out there, there's a misnomer that people who are on the ventilator, mechanical ventilation, that they put them on CPAP. It's really just it's a mistake in terminology. When I was a baby nurse, they used to ask if we were putting patients on CPAP trials, and what that meant is, are we doing weaning trials to try and extubate them? What you're really doing is putting them on pressure support trials or levels of pressure support. It's technically not CPAP, but it's just a common word that we all use in the ICU world by putting them on CPAP trials. That's an entirely different conversation about weaning trials and how we weaned patients back when I was a baby nurse and how we wean patients now. So another different conversation. I will utilize BiPAP in almost every kind of chronic respiratory failure. My COPDers, my obesity and hyperventilation patients, my sleep apnea patients, to try and prevent them from being intubated. I will only use BiPAP in my awake patients who can protect their airway. That is a key ingredient. Someone who is completely out of it, obtunded, and not protecting their airway, doesn't have good gag reflex, I'm not going to use BiPAP. Protecting their airway, as in if they vomit, will they stop the vomit from going in their lungs? If you've ever taken care of an obtunded patient, someone who's drunk, someone who has a head injury, someone who is acidotic, they don't have that ability to stop stuff from going to, they don't have the reflex control in their epiglottis. So if they can't protect their airway and they vomit, they will aspirate, they will get pneumonia, and there's just all kinds of badness and hotness. Look up the term ARDS, A-R-D-S. Yeah. And the settings we use have a lot to do with body habitus and ideal body weight, and then we could have a conversation about ARDS-net protocols. Really, I'm trying to keep this short. Both CPAP and BiPAP, we're titrating these settings for the effect that we're looking for. We'll go to 5, 10, 10 over 5, 12 over 6 to get the effect we're looking for, meaning have we eliminated the problem we were treating. One of the most common reasons we use BiPAP is for hypercapnic respiratory failure. People who have COPD and have high levels of CO2, we use BiPAP to help them try and eliminate the CO2 retention. How am I doing so far, Nicole? Oh, I know you're curious about the heart failure, aren't you? Okay, how in the world does CPAP or BiPAP treat heart failure? We're talking about the lungs, not the heart. Okay, we're giving positive airway pressure, PAP, whether CPAP or BIPAP, we're giving positive airway pressure into the lungs. Your lungs are inside what's called your intrathoracic cavity. Is that cavity a negative pressure system or a positive pressure system? What? Here I am tripping you up with talking about pressures and intrathoracic cavity. Let's make it simple. How does oxygen get into your lungs normally? You're not on a machine in any way. How do you get air into your lungs? Is it blown into your lungs through an external device, meaning someone forces it down there, or do you suck it in? Man. I know, making it funny. So your intrathoracic cavity is normally a negative pressure system because you suck in air. Negative. And what positive airway pressure is doing is blowing air into your lungs. So it's not normal. It's a different kind of pressurized system. Heart failure 101, we have a deficit or a problem in the hemodynamic parameters of our heart. Preload, afterload, contractility. Ringing a bell? No. You will never avoid those three values, ever. So what BiPAP does, let's just go with BiPAP. BiPAP changes the pressurized system inside of your chest, and it actually changes the pressures of your heart. I'm not about to try and explain the 4 different ways that it changes the pressure in your chest and your lungs and your heart, but it changes the pressures that we just talked about, preload, afterload, contractility. More specifically, it affects right heart preload, afterload, left heart preload, afterload. It doesn't really affect contractility, okay? I kind of lied. Heart failure is a backing up of the system, whether left or right heart failure. Your preload or your afterload is not functioning appropriately, so things start to back up. I'll go off on a tangent. Yes, there is right heart failure and left heart failure. There is systolic and diastolic heart failure. So BiPAP, positive airway pressure, actually helps reduce right ventricular preload. It also helps increase overall lung volumes, which can potentially increase right ventricular afterload, then can lead to a decrease in pulmonary congestion, specifically the pulmonary venous system. And lastly, there is a change in pressure from the outside of your chest wall to the inside of your chest wall, which potentially can decrease left ventricular afterload. Let you go back and rewind on those a few times so that you can, get that straight in your mind. But all of those things actually help improve the signs and symptoms of heart failure, which most commonly is fluid overload. Sorry, not improve, but eliminate or help diminish the signs and symptoms. You know what I mean. There you go, CPAP versus BiPAP, and when would I use them in my practice? How'd I do, Nicole? By the way, for all of my new followers, if you found this mildly interesting, leave me a message and let me know. Or maybe better yet, how about if you share my story with a friend or two? Love doing this stuff, love answering questions. In fact, I have an entire vlog series called Hey Sean, where I answer questions from the tribe. They usually start the question with the words, Hey Sean. All of my Hey Sean questions I post on my YouTube channel, so if you haven't subscribed, head on over there. And one more thing, if you haven't heard yet, and you have an interest in anything related to NPs, you should check out Fresh NP. 5 a.m. comes early, man.